recently passed away from breast cancer, and I'm sorry to hear that. It was not genetic, but I'm curious whether it makes sense for me to get a mammogram, even though I am only 20 years old. And that goes in with another question that someone has asked, which is, do you recommend women who have a family history of breast cancer get tested for the genetic mutation? Those are both great questions, and they tie in together. Kind of what I had said is that I definitely want you to know your risk. I definitely want you to know your family history. And the way for you to know your official calculated risk is to go over it with your physician before the age of 30. And in fact, I like to recommend to my young women before the age of 25, because if you do have particularly high risk, you can possibly qualify for genetic testing or qualify for really early screening that could start as early as 25. But that's only if you have a family member who was diagnosed very young. We do see women who are diagnosed in their 20s and 30s, and so their family members would want to get screened particularly early. But for the average breast cancer, which is diagnosed in a postmenopausal population, that doesn't necessarily mean that any female relatives need additional or early screening. That's why it's exceptionally important to have those conversations with your doctor when you're younger, to determine your risk, to determine your need for genetic testing, and set up a protocol that works for you. So is mammogram contraindicated in pregnancy? So that's a tricky one. So overall, we like to reduce the radiation exposure to pregnant women and essentially the fetus. We know, especially early in pregnancy, that there can be some increased risks when there is radiation exposure. They have found that the amount of radiation dose from a mammogram, when performed with an apron, is what we call it, a lead apron, is in theory safe, but most centers that I know would prefer to be doing it outside of pregnancy and outside of early lactation, when the breasts are engorged with milk, and therefore it limits the interpretation of mammography. So we do breast imaging in women who are pregnant when they are symptomatic, absolutely. And I have diagnosed breast cancer in pregnant women. Typically, we're starting with an ultrasound, and then if the diagnosis necessitates, then we will do a mammography as needed. I know that, with women having babies later in life, that it also coincides with their time to start screening. It's another reason why I think it's really important to know your risk and your genetics. I see so many cases where women go on to be BRCA positive. They had very obvious indicators that might be the case. And I'm diagnosing a breast cancer when they're pregnant. I don't want to diagnose anyone with breast cancer, but I really, would love to be doing that post-family planning or just helping patients navigate that situation. So just important to be having these conversations as early as possible with your physicians. Are Underwire bras safe? So yes, Underwire gets a bad rap, and that when it's related to pain, that's totally valid. But when it's related to breast cancer, it's not. So Underwire bras do not cause breast cancer. They just cause discomfort. And sometimes, well, actually not infrequently, we are seeing patients who come into us with breast pain, and it might be related to the bra that they were wearing, but it is not related to breast cancer. So deodorant and Underwire bras are fine and safe. If you want to use a natural deodorant, that's totally fine. I support using as few chemicals as you can when it comes to your beauty products, your hygiene, and your food. But it's not because I'm worried about deodorant or Underwire bras. Is it common for perimenopausal women to get a lot of breast pain? Oh my gosh, yes, guys, it's definitely very common for perimenopausal women to get breast pain that they've never had before. I see, and I think any breast radiologist or any breast surgeon that you talk to will say that breast pain is the number one symptom that comes in through their doors, and that's fine. We get it. Pain is confusing. Pain is concerning to so many people, and as humans, we consider pain something abnormal that alerts us to there being a problem. the thing is, as women, it's so often just a sign of hormonal fluctuations within the body. So it is not always a sign of cancer. And like I talked about in the lecture, it's when it's focal, and when it's one, that one spot focal all the time, doesn't stop. And I would at least wait for a couple weeks before I made that determination of doesn't stop. But if you're starting to have new cyclic pain, even when you are perimenopausal, kind of take a look at, okay, well, is my cycle still stable? If you're someone who's had a 28-day cycle since the time you were 16 years old, and all of a sudden you're 45 or 50 and your cycle's starting to stretch out to 6 weeks or go down to 3 weeks, that's hormonal fluctuations, and it's going to be reflective in the rest of your body. Okay, wow, questions are coming in. Great, guys. Are aerosol deodorants okay? So again, there's nothing in the literature to suggest that deodorants are related to breast cancer. Now, I will tell you, I'm also really into the environment, so I would stay away from aerosols just for that. But it's not because it's going to be causing breast cancer. Do you recommend women who have a family history of breast cancer? Oh, I think I addressed that. Get genetic tested, and again, have those conversations with your doctor. Is soy milk processed soy? That's a great question. My understanding of soy milk is that it's not. It's that it's soaked soybeans and water, and then there's just some sort of processing in the sense that there might be some sort of food processing, like blending. When I talk about processed soy products in particular, I'm talking about those like fake chicken or fake bacon or fake whatever, where you're trying to mimic the meat products. That's when you start getting into processed foods. And that's not related to breast cancer. That's just not going to be good for you based on the number of chemicals and the processing. So many of the other lectures have touched on it, and I feel strongly about it as well. Whole foods, plant-based, no processing is the way to go. Could you speak more about risk associated with oral contraceptives, and is taking HRT a risk factor? So those kind of go in together as well. And like I touched on in the video, there are so many reasons to be on oral contraceptives and hormonal replacement therapy. In fact, I didn't know that Dr. Abraham and Dr. I think it's Patel, would be on before me discussing contraception, but there are so many reasons. It's not just for birth control. And even if it is just for birth control, that's fine. That's your prerogative. Just know that particularly with hormone replacement therapy, it's a hormone that comes from outside the body, and it could increase your risk for the development of breast cancer. But there are some women whose bones would break in half if they didn't take them, who would have such severe postmenopausal sweating, they would be drenched in it, or they wouldn't get any sleep. And you have to make a decision in conjunction with discussions with your physician that's right for you. And in terms of oral contraceptives, most of them function through stopping ovulation, and that has actually been proven to decrease your risk for ovarian cancer. So most breast radiologists that I know are comfortable with oral contraceptives when taken in conjunction, with a discussion with your doctor. Okay, is aluminum chlorohydrate in deodorant fine to use? Again, deodorant, if you want to use a natural deodorant, more power to you. I use a natural deodorant because I like to use clean beauty, clean hygiene, but not because I'm worried about my breast cancer risk. I missed the soy part. Okay, so soy. Soy has phytoestrogens, which are plant estrogens, and cancers are sensitive to estrogen. So if this is a cancer cell, it has like little prongs on top of it, or if this is a breast cell rather, it has little prongs on top of it, and estrogen will go and attach to it. So the estrogen in our body, or the estrogen that might be produced by these extra fat cells, goes and attaches to it. Well, soy, the phytoestrogens inside it, they actually attach to it, and they prevent our body's own estrogen from attaching to it. So they actually protect us from breast cancer. So the studies are showing that early and frequent exposure to unprocessed soy, so tofu, tempeh, edamame, is safe. Did you say it's not related? Yeah, so I said it's not related. What do you think of Beyond Meat? So that's a great question. So that's actually a plant-based, so entirely plant-based. I think both the Impossible and the Beyond Meat, and so they don't have soy in them, so they're not processed in that sense. But at the end of the day, they are processed in some way. We do consume them in our house in a limited fashion, so maybe once every few weeks. Just as something quick to throw on the grill. It's summertime, throw on some corn and some other veggies. But I would not be relying on this on a daily basis, just because it is processed. There's still a ton of sodium, which some of the lectures from yesterday for heart health talked about why we don't want to be consuming large amounts of sodium. So just be mindful and try to consume whole foods. And tofu is considered unprocessed soy. I think Beyond Meat is pea protein. Yep, you are correct. So I don't know the levels of soy that would be, considered normal versus abnormal. I would say just try to have a varied diet of whole foods. If you're eating tofu because it has protein, lentils and beans and nuts and seeds and just plants themselves have protein. So I would have a diverse diet and a diverse source of your proteins. So many great questions. Let's see. Pregnancy after breast cancer. So I don't know what the exact question was there, but I'll sort of address pregnancy and breast cancer. So this is a really quick explanation of why the age of pregnancy affects us. So before the age of 30, we have very high hormone levels, we're of reproductive age. And sort of what happens is that, if our hormones are here before the age of 30 and we get pregnant, the pregnancy during that time, during that 9-10 months, lowers them to here. Even though pregnancy is considered a hormonal state, it actually lowers the amount of circulating estrogen and progesterone in comparison to what our normal reproductive age is. Versus as those estrogen and progesterone levels maybe start lowering in our 30s, if we get pregnant, it's actually above that baseline. And so that's why the age of 30 is sort of your cutoff for whether it's protected or not protected, but kind of protective versus a risk. You can certainly get pregnant you can get breast cancer when you're pregnant. You could get breast cancer when you're lactating. I've seen both. So it's always important to be paying attention to new symptoms, to be monitoring them, and to be reporting them to your physician. When do you recommend women get off birth control when they are planning? I'm assuming that is a question for Dr. Abraham. I cannot address that, but hopefully they'll be able to address that on Instagram or some other forum. For postmenopausal women, when should they do self-breast exam and what should they look out for? So of course, if you're in menopause, you don't have a cycle, so you don't have that mid-cycle date to be looking for. They should be looking for the exact same things: new lumps, focal, one spot doesn't stop pain, skin changes, nipple discharge, discoloration, and lumps under the arm. And again, it's from the collarbone to under the breast, all the way to the side, all the way to the middle, and including the underarm. And sorry, you probably can't see all of that, but looking for the same things and monitoring them, at least for a week or two. Now, one thing that I didn't mention in my talk, when you're looking for lumps, we use a couple of things. Is it mobile? So does it move? Versus is it fixed? Is it soft? Versus is it hard? Those are things that we like to look for. No one expects you to be doing a clinical level breast exam. Your job is to just learn your body, know your body, and know when it's changing. Do breast implants affect breastfeeding abilities? So, have a really open conversation with your plastic surgeon if you're considering breast augmentation. To my knowledge, there are ways to preserve lactation, unless you don't have a skilled plastic surgeon. Also for breast reduction, same. They have ways to preserve it, but I would again have those conversations with a plastic surgeon. Does laser hair removal increase risk of breast cancer? So, I don't have any data on that. And that would be a great conversation to have with a plastic surgeon or a dermatologist when it comes to lasers and some of the other things that they're doing. I have seen more lasers being associated with chronic fatigue syndrome and things like that, but I don't have any data to suggest that it's related to breast cancer. If there were to be, though, I would think it might be associated with just increased inflammation within the body. Cancer is essentially an inflammatory state. It's why things like fiber, decrease our risk for multiple types of cancer. It's just why eating a whole food plant-based diet is better. Are there lifestyle choices that age breasts that we should be mindful of? I'm going to talk about lifestyle choices in general. I don't know how they have to do with aging the breast. I think most of the changes, if you're talking about aging the breast in terms of like maybe them sagging, them not being quite as perky as they were, or them changing in shape, those are often related to, number one, lactation, and number two, stretching of the Cooper's ligaments. So that's just one of the internal tissue structures inside the breast. And when Cooper's ligaments start stretching, like think of a rubber band, right? Like it's really elastic, but over time, if you stretch it and you stretch it and stretch it, it can loosen. That's kind of what Cooper's ligaments are. So, if you're someone that doesn't wear a bra, more power to you. That's totally fine. But you might experience a little bit more sagging later in life due to those stretched Cooper's ligaments. And with breastfeeding, we hear a lot of women say, once those breasts became engorged and then, the milk went away, they were left with a lot of excess skin. In terms of lifestyle choices, though, just to reiterate, we talked about maintaining a healthy weight, eating a healthy diet, avoiding alcohol. I'm not saying you have to be a teetotaler if that's not what you want, but just moderate your alcohol consumption because no amount of alcohol has been found to be safe. There are a lot of great non-alcoholic options, whether you're talking herbal tea, plain water, fruit-infused water, so many great non-alcoholic spirits and beers available on the market right now to be choosing from. So I think that's all of the questions. These were all really, really great ones. If you do have any more questions, you can find me online at Anjali Malik MD on Instagram and Twitter, and my website, www.anjalimalikmd.com. Check out the South Asian Docs Instagram and Twitter, and then definitely be looking out for all these videos to be coming on our YouTube channel over the weeks to come. So if your mom didn't get to catch this, and or your sister or your cousin, tell them to subscribe to our YouTube channel so that they can catch all these at a later date.